New York is seeing a historic decrease in reported overdose deaths.
But with threats of looming cuts at the federal level, those who lead local drug recovery and treatment services are increasingly concerned. Natalie Kutchko reports.
Recent reporting from the CDC shows New York saw a 32% decrease in drug-related deaths in 2024 compared to previous rates in 2023. Approximately 77% of those deaths involved in opioids such as heroin or fentanyl.
I think we don't really know all the reasons why we've seen this dramatic decrease. We do know that there have been several programs that have, taken up more traction. And some of that is the overdose prevention education that Rochester community and the country has invested in, as well as the naloxone distribution, also education around safer opiate prescribing practices, and access to medications such as buprenorphine and methadone.
During the COVID pandemic, overdose deaths surged to record levels across the U.S. With this recent decline comes concern surrounding the uncertainty for continued supports from the federal government. Leaders with Rochester's Trillium Health and Common Ground Health both say this could put programs backed by those federal funds in jeopardy, not only locally but across the country.
One, there'll be no treatment services available for those who want to get into treatment, and there will be no funds to continue the prevention education piece of this, which is very important, again, in our communities. We must keep doing the work until we're told that we can't do it anymore.
As both agencies continue to meet the needs of our community, leaders say they are bracing for any potential changes.
I think we will continue to see more deaths and see less of a decline if we have less programming and support economically for this programming for the community. I think we believe it's correlated. We know that things like naloxone work, and having more ready access, having people carry it just so that they can potentially help somebody that they see is potentially struggling on the street. I think all of that stuff is very important, and all that takes funds.
So just last week, hundreds of researchers and healthcare providers across the U.S., they issued a letter to Congress warning about the, quote, dire consequences that these potential budget cuts would present for substance use and mental health programs nationwide, namely in overdose prevention. We will have more information on resources from the state, also from the local levels, from Trillium and Common Ground that we heard from on our website, rochesterfirst.com. Reporting in studio, Natalie Kutchko, News 8.